A hotel is the last place Jenna Lee Green was expecting her father to end up when he moved from hospital to transitional housing. In early March, Glenn Green was taken to one hotel where he stayed until moving to a second hotel, all under the care of a social services agency called Contentment Social Services.
How did this place come to be? Who vetted it?
Green says her father gets some visits from healthcare workers, but is mainly left on his own.
He said he's very lonely. He just looks at the door.
The agency says it's in the middle of buying the hotel, but the deal fell through. It's defending itself.
We opted into this option because we thought it made great difference. We are not in the habit of putting clients in hotels.
The hotel owners say the agency has not paid for any of the rooms, and they're out tens of thousands of dollars. They say they had no idea the guests would have high care needs.
It seemed like a hospital than the hotel, and so we've been just trying to clarify, and then we just can't get hold of anyone.
Alberta Health Services says when patients are ready for discharge, care teams give them housing options.
Were these social services agencies and these facilities specifically, have they been vetted by AHS when they are presented to patients as an option?
Well, I don't know what you mean by vetted. Ultimately, the individual has a conversation with the provider and looks at that themselves and makes their own decision.
They will be removed off the list, and in fact, we will be reviewing the whole list that currently exists out there.
One health law expert says the buck ultimately stops with the province.
Alberta Health is the entity that has the capacity to legislate if necessary, to implement a licensing regime or to implement regulations requiring oversight of these entities.
One doctor who is involved with the care of these types of patients says there should have been more checks and balances.
I think ensuring that we are sending people off to somewhere they're going to be successful is part of that umbrella of that inpatient care.
For Green, there's no sense of how long her father will be at this new hotel.
We're trying to get him out, but wait lists are long. It's hard.
Julia, you've been at this hotel today. What have you seen?
So, Asha, we've learned that it isn't only hospital patients who are brought here. I spoke with a couple whose nephew is autistic on income assistance and is also under the care of Contentment Social Services in the community. They say that he was brought here suddenly without any explanation. So there are still lots of questions about how many people are under the care of the social services company and how many of them were moved to hotels.
Julia Wong in Edmonton tonight. Thank you.